Hello, my name is Noel Scanlon. I'm the Executive Director of Nursing of County Durham and Darlington NHS Foundation Trust. I wanted to say a few words of thank you to you all for how you've responded to the challenge of COVID-19. This has been by far the greatest challenge of our NHS careers. We have not experienced anything like a pandemic, and it's called upon us all to do something different, new, upsetting, challenging, fearful in the context of an enemy we cannot see. When I spoke to our students a couple of weeks ago, I made an analogy to Florence Nightingale, taking a group of untrained nurses into unfamiliar territory with flawed expectations, but grasping that challenge with vigour, enthusiasm and pride. As our nursing and midwifery workforce, I'm enormously proud of everything that we have achieved together. But in particular, I'd like to say a few words to some of you who've done some quite extraordinary things during this period. Our ward sisters, charge nurses, operating department practitioners, staff nurses and healthcare assistants, you have been the backbone of the service, upon which we have utterly relied to maintain ward services throughout this period. In very many cases, your teams have been dissolved and reconstituted in other areas, and many of your number have been backfilled by healthcare assistants from the bank, staff nurses from unfamiliar departments, clinical nurse specialists and advanced nurse practitioners. And you've enabled us to recapture the teamwork that was previously there in these new departments. So much so that the feedback we've had from patients and relatives has been overwhelming. To our clinical nurse specialists, advanced nurse practitioners, outpatient staff, research nurses, clinical educators, I've asked you all to throw yourself into the front line. And without exception, your response has been magnificent. One of you told me that you hadn't been in clinical practice for over 40 years. I haven't been qualified for 40 years. So that gives you an indication of how people have responded to the challenges that we have faced. Coronavirus has, of course, provoked fear and trepidation, not just for the well-being of our families, but our own personal welfare. But the training that we've offered, both virtually, online, through clinical refresher programs in classrooms, what now seems like months ago, has equipped you all with confidence. But just as importantly, the support that you've been able to give each other in wearing PPE in hot and tiring conditions has been absolutely wonderful. During this time, we've also recruited 60 new registered nurses, 300 new healthcare assistants, and to those colleagues I would like to say welcome. You're joining a wonderful team, and I'm immensely proud of everything that we have achieved together. I would also like to thank some of our returning colleagues. You're aware that in order to open an additional 30% of ward capacity and increase the size of our critical care departments several-fold, we have also relied very heavily upon nurses and doctors indeed, who've come out of retirement, regained their registration and joined us. In some cases working as healthcare assistants until their registration has come through. We're very indebted to you. Your experience and your wisdom, your enthusiasm and your professionalism have echoed everything that we've seen amongst substantive colleagues, and you've made a real difference to the service. In the field of critical care, which I already mentioned, it's important to note the enormous challenges that we have placed upon our intensive care units. Asking intensive care to double, triple, and in some cases quadruple in size in departments not designed for critical care work has been enormously challenging. We've compounded that by asking you to wear very constraining personal protective equipment to protect yourself and manage, of course, the anxiety and fear engendered in patients, not just of this illness, but of your appearance. Your response has been truly humbling. I'd like to thank you all for the tremendous hard work, fortitude, perseverance, pride and professionalism you've shown during this time. This month, we should have celebrated International Nurses Day and International Day of the Midwife. And of course we will do that, but in a very tempered way. Our big conferences will take place later in the year, when hopefully we've got the capacity to reflect upon what we've achieved and evaluate what we could have done better during this COVID-19 pandemic. Of course, this year is also the year of the nurse and the midwife. 2020 is 200 years since the birth of Florence Nightingale. And what better role model could we have had than Florence Nightingale at this time? Florence Nightingale introduced a range of new sciences to the delivery of medicine and healthcare. What she confronted in the Crimea was chaos. She brought order, and she introduced notions to healing around fresh air, clean water, light, and very importantly, hygiene. If I was to say to you, what could you see on your wards and departments today that is a legacy of Florence Nightingale, you wouldn't immediately recognise bedhead centres were one of them. If Florence Nightingale was to ask her soldiers in beds in the Crimea to put their arms out like this, if they could touch each other, their beds were too close together. That distance is what we now call bedhead centres, and is the principle for hospital design today. This distance is 2 metres. Of course, now we call that social distancing. So you can see that microorganisms don't have a bus pass. They require a vector for transmission. And that whole principle around space, fresh air, light, clean water, and very importantly, hygiene, is what she has left us. And she's done that because of her capacity to evaluate data, analyse statistics, extrapolate recommendations, and change how we deliver modern healthcare. She created public health, and as a result, that has been absolutely critical in our fight against this pandemic. So what better role model can we possibly have had than Florence Nightingale? And the resonance with the International Year of the Nurse and Midwife is therefore all the more evident. Later in the year, we will celebrate Florence Nightingale's legacy at our conferences across the Trust. But in the meantime, I think it's worth reflecting upon what she's done for us and how we have delivered modern healthcare as a result of her example.